Joyce Gibb. Thank you so much for being with me today. This is part 4 of the 5-part series on digestion. And today I'm going to talk about the small intestines. So what is the purpose of the small intestines? To actually have a lot of nutrients that are absorbed through that border. We're going to talk about enzymes and sugar absorption. There's actually a test that determines malabsorption. It's called D-xylose test. And it talks about the defects in the integrity of the gastrointestinal mucosa. And D-xylose is a monosaccharide, and it does not require enzymes prior to absorption. But it does require an intact mucosa only for that. So what they typically do is give 25 grams of this D-xylose, then we check your urine in 5 hours. So 25% of this should be excreted in the urine. If it is less than that amount, then it's considered malabsorption. So there is a test that is commonly done for that. So the thing that really makes a difference there, it kind of determines whether it's maldigestion or malabsorption. And the D-xylose test actually talks about the malabsorption component of that. So what else do we look at? So you can look at your stool, and you can check the pH of your stool. Is it low or is it high? The testing that I use many times is through Genova, the GI effects test. And so if there's a low pH, what are some reasons for that? It can be carbohydrate malabsorption, can be carbohydrate maldigestion. It can be a fast transit time, gives a low pH. If you use laxatives, or if someone has symptoms of small intestinal bowel overgrowth, which happens many times with chronic constipation, that bacteria migrates from the colon up to the small bowel. A high pH is kind of the opposite of those things. If you have a high protein diet or a low fiber diet, can give you a high pH. Somebody with doing an Atkins-like diet. There's dysbiosis. There can be a slow transit time. You can have low hydrochloric acid in the stomach, and remember that's very common when you're on a proton pump inhibitor. And somebody has a high pH if they're at risk for colon or rectal cancer. So when are you going to suspect malabsorption? If your stools are light colored, they're foul smelling, they're bulky and soft. And what happens with proteins? You can have fluid retention, dry hair, or hair loss. The sugar component shows an explosive diarrhea, flatulence, and bloating. And then vitamins, like I said, this is where the small intestine is where a lot of nutrients are absorbed. And you have wasting, malnutrition, decreased blood pressure, weight loss, and anemia. So there's a lot of things that can happen in the small bowel. We have many people with small intestinal bowel overgrowth, and it's usually from chronic constipation. And I look to talk more about digestion in part 5 of the 5-part series coming up. And if you'd like me to help you with your journey to good health, just give me a call. Thanks a lot. Thanks for watching. If this information was helpful, hit that thumbs up button down below. If you want more videos like this, hit the subscribe button down below, then ring the bell next to it. Also, if you know other people that you would want to share this link with, please do so, because I would love to help them on their journey to good health.